Hey everyone, welcome back to Ask Dr. Dan. Again, this week the topic was knee osteoarthritis. So let's get to the questions. Question number one. I tried injections without relief. What's next? There's a couple things. So first, what kind of injections did you try? Did you try a steroid? Did you try the hyaluronic acid injections? Did you try PRP or stem cells? I usually like to take it in a stepwise fashion. So if you tried a steroid and had no relief, the next thing I would say is let's try the hyaluronic acid injections and see if that helps, and so on. The other really important thing, and probably the most important thing, is how were these injections done? Many times these injections are performed blindly, where the doctor just kind of pokes around the area and then he sticks a needle in. That is not the best way to do injections. It's been shown that you can miss the joint a third to half the time. So if their injections were not performed guided with something like ultrasound or fluoroscopy, that would be the next thing I recommend, is an ultrasound guided injection. I personally recommend ultrasound over fluoroscopy because you could see the different tissue layers as well. So you could see the fat and you can see where the joint space is, where fluoroscopy you're just seeing bones. I have many patients that have come to me, they've tried the hyaluronic acid injections with no relief. It was done blindly. We try it ultrasound guided and they get much better results. So again, that question all depends on what you've tried and how it was done. The second question, when do I need a knee replacement? So that is a question I get a lot, and the answer is never. You never need a knee replacement. A knee replacement is done when you've tried everything else before a knee replacement and you're still having a lot of pain. Many times we could get people feeling better without ever talking surgery, but we'll get people that have come from the orthopedist and they're told the only thing that they can do is a knee replacement and that's it. And that's just not true. A knee replacement is never needed. It's basically done if that's the last thing you can do. Number three, why wouldn't I just do a knee replacement instead of stem cells? So a knee replacement is a huge surgery. What they're going to do is they're going to make a big incision in your knee. They're going to cut out your knee and they're going to put a metal and plastic knee back in. So it's a big surgery with a big recovery. Many people, it takes 6 months to a year to fully recover. And even after recovery, still many people, even up to half of the people, still have pain in their knee after that procedure. So you went through this big process and then you still have pain. Not to mention there could be many complications, everything from that continued pain. Sometimes you'll get scar tissue where the knee won't bend anymore and then you have to go in for more procedures to break that up. And then of course there's a much larger chance of infection with something like a knee replacement as opposed to something like an injection. So, if you get a knee replacement, you have to go in, you have to get that washed out. And if that's not working, sometimes you actually have to have the whole knee taken out and have a new one put in. So you could see there's a lot of potential issues with something like a knee replacement. So that's why if you can avoid that and try other things first, that's the way to go. The next question. Should I do PRP or stem cells? It's a good question. So the honest truth is you can't go wrong with either. Some people want to try PRP first because it's a little bit less invasive. It's just drawing blood and concentrating your platelets. PRP, the way it works is those platelets release growth factors and healing factors, and then they also call in these other cells to come in and bring some healing to the area. PRP is, I think, for the joints, just not quite as effective a procedure as stem cells. I think PRP works excellent for things like your tendons and your ligaments and muscles, but I think for joints, I think stem cells just work a whole lot better. Because in addition to all those growth and healing factors, your stem cells also have the potential to differentiate and just bring more healing, so they could turn into other types of cells. When I do my stem cells, I mix the platelets and the stem cells so you get both, and I just think the PRP and the stem cells work really well together in joints. Question 5, how do stem cells work? So we talked about that a little bit. So your stem cells are cells that can turn into other types of cells. So those cells can turn into cartilage and they can turn into muscle and tendon depending on what environment they're in. So when you put that in a knee, you get that differentiation where you can actually grow some cartilage and And plus you're getting all those healing and growth factors in there, which changes the inflammatory environment. So what really hurts in arthritis is inflammation. So if you can get rid of all that chronic inflammation, you'll have no pain and more function, even if you didn't do anything to the cartilage. And the last question, kind of like we talked about, will it regrow cartilage? So for PRP, the answer is no, it won't regrow cartilage. For stem cells, the answer is maybe. So it can. It will in some people and it won't in others. The more cartilage that you have in your knee, so if you have less severe arthritis, you're actually more likely to regrow cartilage. If you have a bone-on-bone knee, you're probably not going to grow any cartilage at all. But that being said, even with the bone-on-bone knee, these procedures, again, by getting rid of that inflammatory process, will get rid of your pain and give you more function. So if you still have a bone-on-bone knee on x-ray, but you have no pain and you can walk and you could do the things you want, are you going to get a knee replacement for that? I certainly would not. So it can grow cartilage. It doesn't always, but even if it doesn't, you can still have excellent results with it. So that's it this week. I hope you all have a great weekend. Don't forget to follow us on our social media at Facebook and YouTube at Apex Center for Regenerative Medicine.com and on Instagram at RegenerateNJ. Have a great weekend, and remember, don't operate, regenerate.